Today I'm going a little bit back to basics and we're going to discuss how to select an ICD-10 code. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, national speaker, YouTuber, and eventually maybe a podcaster. I don't know. I'm still thinking I might be doing that podcast. Look out for a poll because I am trying to figure out the perfect name. My channel discusses tips, tricks, and tutorials to make you successful in a medical coding career. And thank you so much because you have made me successful. I have hit my first 1,000 subscribers on YouTube. So look out for the link below to my celebratory giveaway that I'm having. I am going to give away a free certified risk adjustment coder course from my CRC prep class. It's on demand. You have access to it for as long as you need it. So if you enter that giveaway, you can earn one of my free CRC classes and a hashtag medical coder t-shirt. And if you're a fan of going to medical coding conferences, I will see you at HealthCon Denver because I will be speaking on the 14th, August 14th at HealthCon Denver. Come out and check me out. It's at the Gaylord in Denver. It's going to be a phenomenal time. I will be there speaking, and as my role on the Chapter Association Board, I'll be doing all kinds of fun stuff throughout the conference, so I will be there. You can find me, I'm sure, very easily, and I'll probably be broadcasting some stuff live from the conference as well. So let's talk about ICD-10. ICD-10 has been around since the 1930s. Back then it used to just be the cause of death, and it evolved over time that, towards the 70s it became more just diagnoses too, like medical conditions, healthcare statuses. And we are currently on the 10th revision of ICD. We are approved for ICD-11. I don't think we'll be seeing it anytime soon, at least in the United States of America. But we are on, in the US, the CM version, or clinical modification of ICD-10. Other countries have their own versions of ICD-10 that they use, but in here for professional billing, we use our ICD-10-CM, and then they use ICD-10-PCS in the hospital facility inpatient billing. If you open up your ICD-10-CM book and look at the layout, you'll see your coding conventions, the official ICD-10-CM guidelines for coding and reporting, the index to diseases and injuries, the table of neoplasms, the table of drugs and chemicals, the index to external causes of injuries, and your tabular list. Most ICD-10-CM books will give you the instructions for selecting the ICD-10 code. Step 1 is to identify the reason for the visit or encounter. So what is that condition that the patient is having that day that drove them in for that healthcare encounter? Now, obviously, many patients have more than one diagnosis, but let's just start with one, or the primary reason. So once we've identified what is that diagnosis, or in the absence of a definitive diagnosis, it would be a symptom, like if the patient's just coming in with a cough and we don't know what the cause of the cough is, we would just code cough. And that's kind of an easy one because it's only one word. So if we look in the alphabetic index lists all of the diagnoses in alphabetical order, and then references back to the tabular list, so the numerical or alphanumerical order of all the different diagnoses. So if you just have a one-word thing like cough, you can almost use it like a dictionary and find the word cough and then reference it back in your tabular list. So when we're looking in that alphabetic index, we go by the main terms, which is easy for something like cough because that's all the words you have. But in the case of something like urinary tract infection, you have to locate what's called the main term. So if you were to look under urinary or tract, you probably wouldn't find anything, or it might see C condition. When it says C condition, that doesn't mean look at the word condition. It means what's the condition of that other thing that you're looking up. So if you were to look up pancreas, what is the condition of the pancreas? Is it inflamed? Is it infected? And that would be that term that you're supposed to look at, that main term. So in the case of urinary tract infection, that main term would be infection. And then you would go under infection and then urinary tract from there. So you locate that main term, infection, and then you scan those subterms that are underneath them. Pay close attention to the index instructions. Is there something in parentheses? Alternative wording. Does it say see also another code? Is it a not elsewhere classified code? And then choose your potential code and locate it in the tabular list. That's one thing they always stress to you in coding classes, is that when you find something in the alphabetic index, you always verify it in the tabular list. So once we've found it in the alphabetic index, we'll say hypertension. You looked up hypertension and it said I-10. You go to the code I-10 and you look it up and read all of those instructional information there in the tabular index. And then make sure that you are familiar with your ICD-10 coding guidelines. You have to know your guidelines, or at least where to find things in your guidelines. If you can't verbatim remember something, at least you know, oh, here's where I find it in my guidelines. I always like the ICD-10 books where they put the guidelines right in front of the chapter so that I know when I'm looking something up, I just have to go right to the front of the chapter to find those guidelines that pertain to that thing I'm looking up. And then once you've read through all your guidelines, everything in the book, and you're going, yep, this is the right diagnosis code, make sure that you confirm it and then assign that code and then sequence all of your other potential other codes correctly. There might be codes that say code first, which means there's another code that has to go before that code that you were just looking at. Or it might say code also when known, so there might be other additional codes you have to use. Or there just might be sequencing guidelines, like an acute condition gets coded before a chronic condition. So for a patient that has acute on chronic kidney disease, you would first code the acute kidney disease and then chronic kidney disease, because the acute condition always comes before the chronic condition. And again, this is all in your ICD-10 guidelines. Read through the guidelines. If you're testing for your CPC exam or interested in becoming a coder, read through your guidelines just like a handful of times, because you definitely want to be familiar with them. So let me show you an example. So here are some examples of main term. If we're looking at ruptured ovarian cyst, we're not going to look at that description of the ruptured or the location of ovarian. Our main term will be cyst. When we're talking about abdominal pain, again, we're not looking at the location, we're looking at what is that main term. The main term is pain. Chronic sinusitis. The main term is sinusitis. Febrile convulsions. Febrile is describing that main term. The main term is convulsions. So those are the first term that you're going to start looking at in the ICD-10-CM alphabetical index. So first, I would like to say a thank you to Sally Hansen Insta-Dry Nail Polish for making sure my nails always look appropriate when I'm doing book tutorials. So let's say we're looking for upper respiratory infection. When we think about our main term, we would look under infection. So let's start over at infection. So here we are at our infection section in our ICD-10 alphabetical index. So we go to infection, and next we'll check for respiratory. So here we have respiratory, and then we follow our indentation. So we're looking for an upper respiratory infection. We have acute, chronic, influenza, lower, rhinovirus, upper acute. And then we've actually got some further indentations. Is it chronic, streptococcal, viral, due to respiratory syncytial virus? So we don't have that information. We were just told URI, upper respiratory infection. So our good jumping off point here to start looking is J06.9. So let's flip to J06.9. Okay, so here's our category, the J06, which is acute upper respiratory infections of multiple and unspecified sites. And we go to our 0.9, that is our unspecified code, acute upper respiratory infection, unspecified. Now remember, we said we always check for the additional information, any additional supporting stuff we've got here. So it says use additional code to identify an infectious agent if known, such as RSV. So if this is the only information we were given, and it says to use this code if known, if we don't know it, then we don't have to use that code. So if all we were given was just URI, this would be our code, our J06.9. We're verifying this in the tabular. Yep, upper respiratory infection, not otherwise specified. And there we go. We're good to go. So that's the basics of looking up an ICD-10-CM code. If you're looking for more in-depth training on ICD-10-CM coding, I do have a course. I will link that below. It is 2.5 CEUs and it's pretty cheap. I think it's like $22 or $23. Or if you're interested in getting that CRC credential and becoming a risk adjustment coder, which just works with ICD-10 codes, no CPT, no HCPCS, you can get $100 off my CRC preparation course linked below. That is my YouTube special discount. It is an on-demand course. You can access it as much as you like. It does not have an expiration date, so you don't lose access over 6 months or 9 months. You have it as long as I'm in business, you're in business. And it's had some pretty great reviews. Or hey, maybe you'll win my free CRC course in my 1,000 subscriber giveaway. You get extra entries if you are a subscriber, so make sure you hit that subscribe button and that notification bell so you never miss another episode. I will see you in the next episode, and I hope I see you at HealthCon Denver, and until then, you just keep on coding on.